This project is evaluating the impact of a child abuse screening tool and provider education initiative implemented as a pilot in the Good Samaritan Regional Medical Center Emergency Department beginning in May 2018. Child abuse screening and reporting suspicions to Child Protective Services for further investigation is an important part of preventing adverse physical and mental health outcomes across a child's life. Evidence supports that reports made by medical professionals are more likely to be substantiated compared to other fields, but also that medical professionals underreport compared to professionals in fields such as law enforcement and education. The goal of this education and screening initiative was to increase the rate of screening for child abuse, the rate of documentation of child abuse screening, and the rate of reporting positive screens to child welfare agencies for investigation. In the year following the pilot go-live, documented child abuse screening rates increased from about 2.5% to greater than 80% of all pediatric visits to the Good Samaritan Emergency Department. Though the proportion of those cases documented as screening positive decreased as the overall number of screens increased, the absolute number of cases that screened positive for suspicions of child abuse did increase, as well as the number of cases reported to child welfare agencies, leading to an overall positive screen rate of about 2.5% to 3%, which is generally consistent with that found in other health systems in our country with structured emergency room child abuse screening protocols. Since this pilot program, the Child Abuse Screening Tool and Educational Initiative have been implemented throughout the Samaritan Health System. Future work will involve evaluating screening rates over time, as well as comparison between the different clinical settings.